So good afternoon. And for those of you that walked across campus to be here, thank you. Well, let's see. I'm going to talk about text messaging in healthcare. And let me just get started. First of all, I have no competing interests or any conflicts of interest. I'm going to go over a little bit about REACH, technology infrastructure, research requirements, and intervention design and the method of delivery. So first of all, I think many of you know already that text messaging is really being used a lot as a form of kind of ancillary healthcare delivery. So it's not an intervention in and of itself, but it's a potential way to deliver an intervention, and with that it brings many other kind of consequences and issues that you need to deal with and consider. We're going to hit upon some of those today. So these are just some of the ways in the literature that we've seen text messaging being used already. So disease management and monitoring, specifically for asthma and diabetes, promoting healthy behavior, so weight loss and exercise, and I'm going to get into many of these a little bit more. Health behavior interventions like smoking cessation, reminders. Reminders could be for appointments, for immunizations, but just simple reminders. Notifications, which again could be somewhat like a reminder for an appointment, but even a notification of a medication being due. For data collection for research studies, and then disease surveillance, which may be more of a public health application. So I wanted to just go over a few key theories of innovation uptake, because I think this is important to any aspect of information technology, or really any new idea and how it gets spread throughout a society or through a community. So many of you may be familiar with these, but those that aren't, Everett Rogers penned the Diffusion of Innovation, and this was back in 1962, was his first book on this concept. And I think it was last published, he had an updated version in 2003. So it remains very current, and it's really about the uptake of new technologies, ideas, or concepts through a community and how that occurs. And I have a slide that some of you may be familiar with too to show you next. The other person that I think we should all know about is Clayton Christensen. And he is a professor at Harvard in their School of Business. And some of you may have read some of his books, but his term is the disruptive innovation theory. And this is the concept that innovations really have the capacity to kind of change the way we do things. So there are many innovations that, oh shoot. I think with the background, you know, this isn't really visible with the black background. So what this is, and I don't know if many of you can see this, but this is Everett Rogers' kind of diffusion of innovation. And this is the whole concept that you have early innovators that may take up a technology early. And then you have early adopters. Then you have the early majority, the late majority, and then the laggards. And the idea, some of you may be able to see kind of a bell-shaped curve, and the late majority kind of falls right in the center of that. But this is the uptake. So the innovators is a fairly small proportion of people. And then the yellow you could think of as the prevalence, kind of the cumulative uptake of an innovation. And these things occur through communication channels, so through our social systems. Disruptive technology, which is Clayton Christensen's term, and he's had 3 books, The Innovator's Dilemma, or these are 3 that are important to us, The Innovator's Solution, and then The Innovator's Prescription. And The Innovator's Prescription had everything to do with innovative technology and the transformation of healthcare, which he has a nice treatise on how this is, likely to happen and would be beneficial if it happened. So, and many people, when they first hear the term disruptive technology, they think of it as like, maybe our email pop-up interrupting us all day long. But this is really, that's what I thought when I first heard it. I'm like, oh yeah, I know what that is, but no, I didn't. So this is really the idea that a new technology kind of unexpectedly and kind of persuasively becomes entrenched and really displaces the old way of doing things. So a good example of this is the personal computer and the things that we do with a personal computer now that have, vastly changed how we did our work in the past. Another one is the cell phone, really. And so those are two things. And text messaging is a variant of smartphone use, maybe another area where this is likely to take place. And McKinsey Global published a paper just recently where they identified 12 disruptive technologies that they thought would really transform the US economy, and mobile internet usage was #1 on their list. And they talk about the potential to transform both business, finance, healthcare, but really everything that we do. Hype versus hope in texting. So there are some things that we need to think about and that I want you to consider and think about while I'm speaking today. And this term was by Lebreek, and he has a paper that I think is in press or just recently published now, where he kind of writes about the hype versus hope. So our hope is that this may be a disruptive technology, a disruptive way to communicate with people that's more efficient and certainly is additive and complementary to many of the ways that we communicate with people now. The idea being that we could give people kind of, in real time, or what I like to call right time, the right information, that information may be appropriately individualized, and that and by individualized, I think that there may be some constraints on how individualized information can be, but that certainly it would be kind of tailored to certain classifications of people based on either their characteristics regarding what they need to know, what they're ready to know, and what the context of their disease may be. So it's not specifically individualized necessarily. But what we have right now is we have a lot of pilots and a lot of implementations that have really been done without rigorous evaluations. And so we do need to have better evaluations of these systems too, and that's where some of the hype comes in. We have seen, though, an increase in the number of randomized clinical trials that use text messaging. So in 2012, there was about 215 relevant studies, and when I looked at this yesterday, there was probably about 393 that were registered. So we do see this increasing, and I think that this is obviously beneficial. So what's some more of the hype? I think we're all concerned about the fact, okay, so 1 or 2 text messages may be helpful. What happens when we start getting kind of hundreds of text messages in a day? Have we increased kind of that noise to value ratio so much that this is no longer helpful for us? The other issue that comes up is just, how many kind of health apps are already there for us to use. And many of you probably use one of these for one reason or another. And this includes things like personal monitoring devices, way that we monitor our own lifestyle, whether that's exercise or our diet or medications that we may take. And many of these have not been reviewed by the FDA. I'm not saying that many of them do, but just that there's a proliferation, and it's hard to know maybe how helpful some of these applications are. And they also may be competing for, our time and attention as patients. So what's the reach of this, and why are we so excited about this? And probably everyone in the room here knows that cell phones are pretty ubiquitous. So in 2012, there was 322 million US wireless subscribers. There were 184 billion text messages sent per month in the US recently. And there's 6.8 billion mobile subscriptions. That would be, 96% of the world's population if each subscription went to one person. It's probably more likely that there's about 4.5 billion unique kind of individuals that covers. But this is a phenomenal amount of people, really, that have access to mobile phones. And this is the way we'll connect, to many of these people to the internet. And for some, this may be the only way they connect to the internet. Most text messages are actually read within minutes of receipt. We all know that. There's probably some of us that have been receiving and sending them right now, right? Because most of the time they don't take up too much cognitive ability. I mean, you can glance at a text message and do many other things. They really, don't seem to distract us for long. 86% of US consumers send or receive at least one per week, and I'm sure many of us send many more than that. So there's over 2 trillion sent in 2011. And I thought that this was interesting, that mobile coupons are 10 times more likely to be redeemed in print. And I think of that just because, this isn't just someone looking at something, but this is someone kind of receiving something, acting on it by text messaging. And so it may offer, some of us some thoughts about how we might want to use some of these technologies. So those were the basics, or at least background on text messaging. I'm going to go into a little bit of just the basics of the infrastructure. And this is more, I'm not talking about the person-to-person texting that many of us do, but more when we want to reach out from a research perspective or a healthcare entity's perspective of reaching many people. So I'm starting at the left and going to the right. So this is the kind of the short message service, which is the other term for text messaging, right? System user. So this would be, the researcher, research assistant, kind of using a software application that connects to a gateway. And you could think of this as kind of a switch that is triaging the messages and sending them where they need to be. And then those little radio or those little towers there are the short messaging service centers. And each wireless operator, like Sprint or AT&T, has their own center that actually routes messages. And then they route them to their kind of, their customers, their clients that have their service. So this is kind of the way, we may often be setting up a text messaging system as a researcher. And so we need this software application, and we need to make use of a gateway. And sometimes those things are together in one product, and sometimes they're separate. So, if anyone has any questions or anything during this, please feel free to ask. I'm happy to stop. So a little bit about the basics. So 160 characters, and I think, many of us, when we go over, we get a new message, so it doesn't seem to be a problem. We can be verbose. There are both short codes and long codes that we need. Short codes are usually dedicated codes that you lease from a short code administration service, and this is a national service that actually administers these codes. There's another distinction in short codes between just a regular short code and what's called a common short code. And a common short code is available across all wireless carriers. And I think for one of the reality shows where you can judge, I think you need like AT&T service because it's not a common code if you want to send in your vote. So these are often used for things like that, and it's free. If someone's using one of these just regular kind of codes that's carrier specific. For most of our work, we would want a common code because we want it to be recognized by everyone and be available to everyone. There are vanity codes, like Coke is 2653, and it used to be thought that for most of our applications, we would want to use a short code, that those were easier for people to recognize, and probably better from a kind of a health intervention perspective. I think we no longer think that because long codes are actually, they are dedicated 10-digit or 9-digit numbers, or 10 or 11-digit numbers, and it's the same phone number that a business may use, so it may be recognizable by a customer because they know that number. And originally they were intended only for person to person, but now they do support bulk messaging, and they support many of the soft text software applications that we may be using. So what are some of the features? One of many, most of you saw the text messaging guide that was available on the table outside, and that has a lot of details like this in it, but I'm going to go over some of that. But a lot more detail is actually in the guide, and there's a lot of references and resources in the guide too. So some of the features as a researcher that we may be looking at are things like, do we want our texts to be just one directional? Are we just sending out an outgoing reminder, and we don't care about any response, we don't want a response? Or are they bi-directional? What type of scheduling of the text messaging and what type of queuing do we need to have? How tailored or personalized are they going to be? And are our responses going to be closed or open-ended? And one thing that I think is interesting for us to remember is that if there's a response to a text message, for instance, let's say I'm going to send out 2 text messages as part of my study, and one of them is, did you eat your planned 3 servings of fruits and vegetables today? Yes, no. And my other question is, did you exercise your planned 30 minutes per day? And my answers are yes, no. If those are my outgoing text messages, and those are my 2 answers, and my answers look the same, anyone who doesn't necessarily respond to one and responds to the other, because my answers are the same, I don't really know, if I've sent both messages out already, I don't really know which message they're responding to. If they respond to the first one before I sent the second one out, then I know. But my answers are the same, yes, no. So one of the things that one would need to consider in a research study is that they actually put something next to the yes, like, yes, I exercised today, or yes, I had my fruits and vegetables. So if they don't come back, someone may take a while to respond, that kind of thing. So that can be important. Responses and branching logic, I think many of you can imagine what this is. So depending on the response, what's the automated reply that goes out? There's also capabilities for multimedia messages, although a lot of people, at least depending on who your audience is and what the population is that you're working with, this might be something that's discouraged because not everybody has access to this type of messaging, or it can be very costly to download a lot of data, whether you want to do voting or polling. So this is really application features. And I broke this down into application features, management features, and then one other feature. So as far as the management features, we want probably to keep track of things like who opted in, who opted out. We want to be able to create groups. We may need a web portal system to access the information. It could be that our recipients need one too. So some of the other recommendations have to do with gain frame and loss frame messaging. Some of you may be familiar with this because this concept is certainly not new or isolated just to text messaging, but this is any type of communication to help patients make decisions and to help inform patients. So gain frame messaging is when you're really reminding someone about a positive reward. So an example would be the smoking cessation aimed at smoking mothers of young children reminded them of the benefits to their children. So you're reminding someone what the benefit is to make a certain behavior change. And with a loss frame, you're reminding them of the negative consequences. So this may be something like lack of sun protection may lead to more wrinkling and more. So this is negative. And then there's also the concept of tailored messages, and this is something that's kind of modified to the recipient. So I think it's interesting to read about the gain and loss frame systems because it's really thought that the framing impacts the individual's willingness to incur risk, either to encourage a desirable outcome or actually to avoid an unwanted outcome. There's another theory that suggests, and this is a prospect theory, that when benefits are fairly certain that the gain frame may be more effective. But it's interesting to me that there's a real lack of consistency in the results regarding gain frame and loss frame messaging. And the Cochrane collaboration had a nice review on this, and I think it's very hard. It seems like the inconsistencies revolve around both whether the messaging is kind of prevention, whether it's screening, whether it's chronic disease management, but even within those types of domains, it's still hard to make firm conclusions about what type of messaging is the best under what conditions for whom. And I think the bottom line is that there's probably a lot more work to do to help us determine what types of messaging work best for which individuals and when.
Dr. Schilling, can you, on the second bullet point, give an example of prospect theory where the benefits aren't fairly certain versus where they are, just to
Yeah,
contrast?
so I don't know if I have an example of that or not. So, this was actually, and it's interesting to me because I think some of these examples that I read in the literature, many would be, I think we would disagree on whether we thought that was certain or not. So the mammography in breast cancer was thought of as an issue of uncertainty because you don't know if you're going to get breast cancer. The sunscreen protection and the wrinkling was kind of thought of as being kind of fairly certain. That people knew that they were likely going to wrinkle as they aged. And now whether, to me, this, I had a little bit of a problem with that because I said, well, shouldn't certainty be on whether this really helps or not that this is going to happen. So, but they seem to think that some people feel more certain an event is in their future than not.
Would you attach, it seems like there's a dimension which is related to certainty, which is directness, obscurity. I'm thinking of things like blood pressure benefits that people may be certain about, but they're sufficiently in the background that they may, it may not be a clear, concrete benefit.
Yeah, or it's not so proximal that they feel aware of it. I mean,
exactly.
Yeah, and I think that's why there was so much, that the Cochrane did a wonderful review on this, and a lot of the studies, I think, were not high quality looking at this. They left a lot of room for limitations and other ways to think about this. So tailoring, there definitely seems to be some evidence that tailored messages improve outcomes versus untailored messages. And so how do we, what does that mean to tailor a message? And kind of the content that's delivered, the framing of that content, and then the delivery method, like by whom and how, all seem to be important in the tailoring. And it's interesting, there were some concrete examples here of just how tailoring kind of can enhance our goals. So in order for a message to kind of have an impact, we need to kind of be attentive to the message. So we can't ignore it, right? We have to read it. We have to kind of exert some cognition on it. And some messages that are tailored tend to enhance our ability to process the message. And then the message, we have to have an enhanced impact. It has to affect behavior. So not only do we have to pay attention to it, but it then has to affect our behaviors. And what we'd like to know more about is which aspects of the tailoring really matter. So this is a continuum of tailoring, and we can't see I can hardly see the reference down there now, but we do have them printed out, and this is from Hawkins. And they spoke about there being two kind of aspects that we needed to look at. One was audience segmentation. And this is really the concept that we're trying to kind of divide and distill kind of our audience into more homogeneous groups so that we can, and how much you can do this. I mean, you could think of, how granular is my categorization going to be, and what are the necessary factors that I need to categorize people on? Which are the factors that are going to matter? And then the customization concept is how customized is the messaging based on that segmentation. And how does this work? What does the tailoring really impact? So I already talked a little bit how it impacts our ability to pay attention. It may impact our kind of desire or motivation for effortful processing. So this is when we really kind of put some cognition into the message. And it's interesting that, authors reported kind of both pros and cons from this. That yes, you really do need to consider something if you're going to make a change. But also, by considering something, you also may be considering more the risks of the change, the unpleasantries of the change, and all these other factors. So you could maybe stimulate the reverse by having someone think too much. Well, kind of interesting. Then there's kind of the emotional processing of the information. So, and this would be the concept that someone they feel positively towards your message. So maybe, it's coming from their doctor's office who they know, it's coming from the Mayo Clinic, an entity that they respect, so something that has kind of a more emotional tie. And self-reference is the idea that the material is linked to kind of me in my own needs. So a message that could be tailored to me might talk about how, if one of my goals were to run a marathon, that by doing this exercise, it's helping me to reach my goals. So it's been kind of personalized to me in a way that I can reflect on my goals, and this makes sense to me and they motivate me. And then these are some strategies to do these things. So I think personalization we've really hit upon, but this is the concept that this is for you. And it's interesting, there were some studies where they looked at, does it need to kind of say, Lisa, you've got to eat 3 fruits and vegetables today? Or can it just say, this message is specifically designed for you. You have to eat 3 fruits and vegetables today. And it looked like both worked, actually. That it didn't necessarily, as long as it said it was specifically for me, that may have an impact. Feedback is another very important way to tailor messages. So again, this can be, you're giving information back to people, usually that they've already given you in one form or another. So whether that's from electronic health record information, if you're in kind of a tethered system, or a personal health record, or whether it's something that they filled out or information they gave you. And usually we break this into 3 categories also, whether it's descriptive, so if I see you ate 3 fruits and vegetables today, good for you. Evaluative, you did this, but you wanted to do that, all right? Or comparative, how did I do compared to the rest of my peers? And then content matching is the concept of really directing the messages to people's thoughts and knowledge about key determinants. So,
Dr. Schilling?
Yeah.
Do you know the author on that last reference there?
So, what? I can get that for you. I don't see that I have it on there, but, yeah, so I'm sorry, I don't. And then this is from Sheena Bull, who does a lot of work with text messaging. And I like this very much as a way to kind of design a text messaging intervention, or to use text messaging as part of your intervention. And she calls this a text messaging library. And then every message should really be linked to the outcome that you want to impact. So here the message type or outcome is the reminder. So we want to remind people to have regular exercise for increased fitness and weight loss. The message content, so here it is, 30 minutes of exercise each day can improve your mood, increase your energy, and help you back into your favorite pair of jeans. What the character count is, the date and time that it would be sent, who it's tailored to, so here it's tailored to women age 35 to 50, and then the theoretical construct. So this is a game frame message, it's, it's positive, and The risk is exercise, meaning that's kind of, that's the skin in the game that the recipient has to put into this. And the gain is mood, energy, and appearance. So a very nice way to kind of think about how am I going to create these messages, what's the purpose, what's the communication and behavioral theory that supports this message being used. I'm going to shift gears again. I'm going to go one slide. So I'll go back to that other slide. So I think we're all familiar with the Health Insurance Portability and Accountability Act, but just how this impacts mobile technology, which would include text messaging, but mobile health is much more than text messaging. But the security rule stipulates that we have to have specific standards for disclosure and storage of electronic health data. And we have to safeguard personal health information. And this does include text messaging. And then, sorry we can't see this, but the Federal Trade Commission also has enacted this CAN spam regulation. And this really states that for any kind of text messaging campaigns, that there has to be the ability to opt in or opt out of them. Now this may be much different than a research study that we may be doing where we're getting consent and they're opting in by virtue of their consent. But it's just something I think that's worth remembering that this law does exist. So what do we have to be concerned about? Well, I think there are some concerns. I mean, people, text messages can show up partially on people's phone. We all leave our phones sitting around on conference tables when we're in conferences or on our desk or who knows where, the counter in the bathroom or, a number of places. And phones can be stolen. So there are only kind of suggestions in this regard for research, but I think it's probably wise to restrict the amount of information that we send. And we're already restricted somewhat by a 160 character limit, but also the content of that information. There are many things that people probably wouldn't want flashing up on their cell phone. We can also advise participants to protect their phone, and probably most of us have logins and passwords that we use on our phone. But there are other things too. I mean, we can certainly limit such that no information shows up, but just the sending number. Anti-theft and remote locking devices and wiping of data. And I think that should actually be recommended for anyone who, could do these things and is participating in a research study in text messaging. Encryption is the other thing, and messages are definitely encrypted in the air. There's a lot being published now about the strength of that encryption and how secure the encryption really is. And I think it really depends maybe what type of work we're doing and how concerned we are about the protected health information and the security of this information to influence what we would want to do here. But there are third-party systems that exist that can both, use stronger encryption methods to send text messaging, and most of these are available free. You can download them. There's also self-destructing text message systems, just like Snapchat is for photos, so that you could have messages that self-destruct. So I think there's a lot of kind of opportunities to kind of make sure that we're at least doing things that our patients or participants may be interested in.
So if you're working with, say, an outside vendor that is going to be managing your text messaging platform, what is their responsibility or obligations to either get trained or commit to maintaining confidentiality of, data results that a participant might be text messaging back to their platform that they can see, whether it's HIV result or
Right.
something like that? Do they have a responsibility?
That's a really good question. And the people that tend to have kind of the most written about, we abide by HIPAA regulations and we understand these, are certain vendors that actually kind of support applications that are used within healthcare systems. So not used outside of them, but used within, because there's a lot of healthcare systems now that use them, like between nurses and doctors and doctors and doctors, because it's so much more efficient than, pagers or even cell phones. So there's really a disruptive use of the technology, you know, within the healthcare system. But it's a good question with vendors, you know, working kind of outside a system. I think it's good to ask, actually. I don't know what every vendor would have, and I'm sure most of them will tell you, well, our messages are encrypted. But does that, you know, that means it's encrypted across the wire, you know, what's the strength of that encryption? And probably more of our concerns are, you know, it's showing up on a cell phone or someone's cell phone being stolen, or, you know, for people that may share cell phones and things like that. And that's where some of these other applications and I think just recommendations could be very handy.
I was just gonna comment on the amount of variation we've seen in how just Comer interprets text messaging, with some panels feeling it's pretty much the same as an auto-dialer call, you can leave a message, and other panels thinking it is not. And then across the country, because I do a lot of work with other people around the country that are doing this, there's a lot of variation in what people think is okay. So this is, I think really, we're at the beginning of understanding what the regulations are going to be.
All right, so this is actually, I'm at the end of my talk, and these are just some parting thoughts. And I bet there's lots of people in the audience who have experience with doing some of this work, so I think it would be interesting to kind of hear about some of your experiences. So, you know, the widespread use of text messaging really has great potential. It really may be a disruptive technology in healthcare, and it may help us reach more people, you know, more efficiently. But there are some concerns. I think that there is a concern about the noise to value ratio. I mean, even looking back what's happened with email over the last 10 years, I mean, I know lots of times now when I want to reach somebody quickly, I'm not going to email them. I'll just text them, even though I'm sitting right there on my computer and I could email them. It just wouldn't work. So it is an intervention method, and it's often in healthcare applications. It's often paired with other things. So I wouldn't think of it as just an intervention alone in most circumstances. We really need better evidence about the best ways to construct and deliver information and the impact, and what tailoring, or this concept of kind of personalization, may really mean, and how we can best use that to impact outcomes. It's a rapidly evolving technology, and with so many applications being developed, I do kind of wonder sometimes and get a sense that things aren't going to just happen before we really have an opportunity to kind of study them well. And I was thinking about, you know, I'm sure when the telephone came out, I was wondering, did people think about, like, should the person picking up the phone say hello first, or should the person making the call say hello, and who says goodbye? I mean, I guess you could have asked many questions about how to communicate via the phone when it came out, but they all seem somewhat ridiculous right now, right? And so but you know, we're not trying to impact change with those communications either. So the thing is here about trying to impact change and behavior change, or medication adherence, or whatever it may be. So, and I think that academic industry partnerships may be very beneficial in this sense, where there is rapid prototyping and things are changing so quickly. And you can see that a lot of these applications will likely be paired with other technologies, whether it's a personal health record, or having access to your own electronic health record through a tethered system, or having a mobile app that you're setting up that then sends you text messages and reminders. I mean, I think a lot of this may begin to happen outside of the context of, you know, what we do as healthcare professionals per se, and what we study as healthcare professionals. I just think there's so much happening, and this is so rapidly evolving right now. So that is all I have for this afternoon, and I would love to hear from some of you that have experiences with this.
Just to add another acronym of alphabet soup to the discussion around HIPAA and the FTC's CAN-SPAM Act, something that we ran into at Denver Health very recently with attempting to operationalize the results of research into a practice was that we're also subject to the Telephone Consumer Protection Act of 1991, which as of this past October was updated to expand to cover text messaging specifically, and also to govern the definition of an established business relationship with your patient or with your client whom you're doing outreach to. I think the intention of the law is to protect consumers from receiving a lot of auto-dialed calls on their cell phones with the associated charge and use of minutes, but that also now governs text messaging in practice as well.
Oh, great, thank you.
I've seen a lot of randomized clinical trials using text messaging where the PI or the study group will actually provide participants with a cell phone for the duration of the study, and oftentimes it might even be a smartphone. And I was just wondering your thoughts about that in terms of like how to interpret that data in a real life setting, because I, for example, work within underserved communities that not only don't often have smartphones, but they may have their non-smartphone on for like a couple months, and then they'll get it turned off, or they'll get a new number because Cricket has a no contract plan. And so I sort of see a lot of the really rigorous studies providing these goals because they get a lot of funding to pay for them. It seems almost like doing a study on, you know, how well someone can get to work and then giving them a car, a new car, and gassing up the car, and then after the study is over, taking the car away. You know, so I was just wondering, how would you, in terms of designing like the most effective sort of real life self-text messaging study, would you encourage providing participants with phones? And obviously that would keep them in the study, but how can you sort of interpret that in a long-term capacity? You know,
Right. Well, first of all, I'm sure I'm not the only person in the room that would have a thought on this. I don't know that I have, I don't think there's a single right answer to this. And it almost seems a little bit like the efficacy versus effectiveness type study, right? Where in the first case where you're giving a phone and I don't know if people in those studies that you're thinking of could use that phone for other things or if it was kind of limited to this. But it does seem highly controlled. Everybody has the same phone, they have it for the same period of time, there's no on or off. So I think that does seem to me, that's kind of very maybe perfect world in some sense, perfect case scenario. The other situation where people are using their own phones, then I think the fact that people have their phones turned on and off and service disrupted, that's very real life, right? The fact that there's lots of information likely coming in on those phones and lots of different ways that they use the phone is very real life. So I don't know that it's kind of a one or the other, but I think you're right to kind of say that each way probably presents its own limitations on the results or its own limitation on how you can generalize the results to others. So. And from what I had seen too, that was the idea of giving phones too is even more common in kind of, underdeveloped or poorer countries. And then also kind of when text messaging, when the studies were just being kind of started, but almost like there's been an evolution a little bit. I don't know if you've seen that. I'd have to line up all the dates to be certain. But does anyone else have any comment on that?
I guess I would just say it's so great that to do something where you're giving cell phones out, maybe when you're trying to develop the messages would make sense, but in terms of actually testing an intervention, I think most people would favor more the effectiveness spectrum than the efficacy. And even in the developing world now, actually, in many countries, there are more cell phones than people, even in the developing world.
Yeah, the developing world, I think, is where you see a lot of these text messaging plans being rolled out, at least in trials, and not to sound like too negative about it, but in terms of that other community you're talking about, personally, I want to say it's actually worse than that. There's a tendency, I think, for people to recognize when they're designing trials, hey, look, they've got all this cellular coverage now in Africa, so let's roll out an SMS trial, you know, and there's so much more infrastructure needed than just, you know, the cell towers and even just the phones. I mean, you can send out SMS messages about, hey, you know, these vaccines are now available in this town over here, which is, you know, a lot of the kind of MOTEC-based stuff that they do, where if you're trying to increase vaccine coverage, you know, a lot of the problem is just inventory and accessibility and things like that. But, you know, you're telling people, hey, this vaccine's available over there 50 miles away. Where's the infrastructure for them to go and do that? You know, how are they going to get there? And so, you know, there's a lot of value in something like this, but you need to recognize the complete infrastructure that's needed for something to actually work. I kind of have this like, kind of hyper-negative term I use for that. I call it let them eat text. You know, where like, hey, you know, all these people in Africa need vaccines. Where we go, let them eat text. You know, let's throw out some SMS programs. But if you don't have roads for people to go and get there, if they don't have, you know,
Refrigerator.
fuel, yeah, exactly. There's just, you know, and so that's obviously like the worst case scenario. I'm extremely negative about it. But even in a like a smoking cessation program, I mean, nicotine is like more addictive than heroin and cocaine, right? And so, you know, you need to set up a trial with endpoints that are reasonable, so that if you actually came up with a 20% success rate for smoking cessation, that would be amazing, right? And you know, there's just a lot more going on than whether people have cell phones or not yet.
No, that's a good point.
One of the side effects of that, we worked with a project in Haiti, and about 5 years ago when cell phones came to Haiti, all of a sudden church attendance went way up, and people would come in because the generator ran in the church on Sundays, and they would come in with pockets full of phones and just start shuffling, filling them up during service to load them up with the electricity was pumped in.
All right. Yeah, any other comments or, yeah, Lynn?
So I'm a librarian, and I just want to point out that 2013 was the year that SMS text was added as a index term in PubMed. So I just want to caution people who are interested in this area of research, if you're doing the literature review, to be very flexible in your searching, and of course the library is happy to meet with you or talk with you to help you with your search. I discovered working with Dr. Walker, how long ago was that, a year ago or so? It takes a little bit of creativity really to think about all the ways that you might search for this topic.
Yeah, that's great, thank you. 2013.
As a follow-up, are there any other resources on campus for who is doing these projects or the type of IT platforms on campus or in the area?
Well, you know, Sheena Bull does a lot of work in this area, and she's not here, but Ellie and Sheena have worked on a, a rapid prototyping lab that Sheena's actually running now to do rapid prototyping of studies regarding kind of text messaging. So whether that's kind of, you know, developing the messaging, doing the programming, but to really help kind of turn things around a little bit faster. Ellie, is there anything more to say about?
Well, first of all, there's a working group that we have for researchers who are interested in mHealth. So if you want to contact us and become part of that group, that'd be great. I think there's a fair amount of expertise around in terms of taking things off the shelf when you need that, when you don't, and when you need to design something more complex. And then Sheena Bull's, what is it called now? Is it a lab? I think it's a laboratory.
mHealth Lab?
Yeah, mHealth Lab or something. Which is co-sponsored by CRISP, which is sponsoring the seminar series, and the School of Public Health, is focused on developing those types of messages. So I think if you want advice, there's some good people to talk to.
Thanks.
Sure.
I was just gonna say, I'm doing a Piltrup, and I'm fairly new here to Colorado, but we have a series of publications under Ybarra, YBARRA, and Piltrup on text messaging on smoking cessation. So if I can help with that. The things that I'm seeing happening next, and we're kind of talking with a colleague at University of Michigan, and what they're working on is
artificial intelligence compared with text messaging, which is kind of like how Amazon knows what movie, you want to get, and so that's like really super tailoring, based on like your choices and answers, and I don't know a lot about that, but I think that's kind of where things seem like they're going next.
I was just gonna say, we have this pamphlet that Lisa developed with a group of us that sort of gives you the basics. Did we put it up?
They're on.
Yeah, I think they might be all gone.
So they're
I
all-
put a couple more out.
Okay.
Oh,
So
okay.
feel free to take one if that's an area of, and if we don't have enough, just contact us, we'll try to get you another one, okay? So that tends to break down some of the basics about when you might need something more sophisticated. That was designed with the idea of making it useful for people who are starting out and need to know even what the questions are.
Well, great. Well, thank you, everyone. I appreciate it.